Good evening, friends, the orthopedic surgeons and the members of the Bombay Orthopedic Society and the postgraduate students of orthopedics. I am recording this video to teach you, to make you aware that non-operative management of back pain is the most accepted and good treatment for all the back pain patients. Why I am recording this video? Because today only I have gone through the Ortho TV interview or presentation by Dr. Dragnivesh Tikoo. He is contesting for the post of executive member of the Bombay Orthopedic Society. I have fully viewed the video presentation, also have heard the doubts by Dr. Bijlani. Friends, I am in orthopedics since 1978-1980, where I was working in Bombay Hospital with Dr. K.T. Dholakia. I worked with Dr. Vikram Marwa, who is known for non-operative management of back pain. Further, there are great surgeons of Bombay and or India who have worked for non-operative management of back pain. I would like to show you the book written by late Dr. Dayanand Dongaonkar, who has presented his work on back pain, the role of yoga. That book is available in the market, and all the orthopedic surgeons, students must read that book. So please view this book. Its foreword is written by S.M. Einstein, Director Spinal Disorders, Robert Jones, Hunt Orthopedic and District Hospital, UK. This has also been recommended by Dr. H.R. Nagendra, Yoga University, Bangalore, Karnataka. Dr. K.H. Sancheti Sir, Professor Emeritus in Orthopedics, he is Padma Bhushan, Padma Vibhushan. And late Dr. Dayanand Dongaonkar. See, this book is available. You can go through it. So what it mentions? It mentions the biomechanics of the abdominal muscles and back muscles. Those biomechanics and the strength of the abdominal muscles and paraspinal muscles, they must be maintained. Further, I would like to show you, when I went to USA, I have been to this chiropractor who gives computerized spinal decompression. Further, I would like to show you my photographs of Sarvangasana and Mayurasana, Vajrasana, which I do daily. You can see Dhanurasana, which I am doing. Now, Dr. Dragnivesh has detailed mentioned the clinical examination of the patient. I agree, I have accepted everything that. But while mentioning, he has gone for X-ray, MRI, CT scan, all these investigations. Now I am working in civil hospital for about 25 to 30 years. I am working there, where very poor patients come there who don't have even 2 rupees to pay for the case paper. Now, I was also very much enthusiastic when I worked with Dr. Dholakia, Dr. Marwa, even Dr. VM Iyer, and recently I am member of the Global Orthopedic Group, which is run by Dr. L. Prakash, where all of these people, they mention that 90% of the back pain can be managed conservatively. So, my say is that don't hurry for MRI. Now, let me tell you my experience. I have presented non-operative management of back pain in clinical meeting in Wadia Hospital. I have also presented failed back syndrome, that means recurrence of the back pain after some years of surgery. I have presented this in 2013 at D.Y. Patil Medical College. Now recently I have presented this at Nair Hospital. So friends, clinical examination of the patient comprises, which Dr. Dragnivesh has not mentioned, the measurement of body weight of the patient. My view is that the back pain which occurs, why does it occur? It occurs because patients put on weight. Now there are many reasons of putting on weight, especially ladies after cesarean or after delivery, especially after cesarean, because spinal anesthesia is given, they start complaining of back pain. So, first and foremost thing for examination of any patient is weighing their body weight, which has not been mentioned by Dr. Dragnivesh. Second thing, that why and how this disc protrudes. Why does this disc protrudes? Because the patients don't care for their back. Now my concept is that, and my observation is that, young patients or old patients, while getting up from the bed, they get up straight. So I advise them to turn on one side, take support, and then get up. Similarly, young patients, they also get up in the morning, body is relaxed, and they get up straightway. And in the relaxed position, the disc protrudes and they start getting pain. So no sooner a patient comes of back pain, male or female, I measure his body weight. And apparently when I ask them, you have put on weight, every patient says, I have put on weight. Now, then next question is that I examine the patient. Mostly, whatever I rely on is straight leg raising test, active as well as passive. Now, the importance of straight leg raising test is that once the spasm the disc protrusion is reduced a little, pain relaxes, and his straight leg raising test becomes negative. So that is the diagnostic of relief of pain. And the disc which has protruded might be going few millimeters inside. So friends, what is my protocol? Dr. Dragnivesh has said that bed rest. See, no patient will rest as advised by us. So I put that patient pelvic traction. I put that patient pelvic traction, and how much traction? 20 kgs of pelvic traction I put them. Same time I put them on diet. I stop all their chapati, roti, rice, all diet I stop, and I put them on salads, sprouts, oats, and liquids. So this diet and complete bed rest with pelvic traction. With this and analgesic, of course, and short-wave diathermy. With this, pain relieves and spasm also reduces, and patient feels better. Now, why do I don't do MRI, or I have written on my board no MRI, only X-rays? In olden days, we used to rely only on X-rays, but now digital X-rays are there. They are very good. MRIs, I have seen I have written this pamphlet where I have seen that the MRI reports showing protruded disc and have been advised surgery. I have treated them non-operatively. So my suggestion is that the rest which is being said, this I observe with all the patients who come to me who have been advised surgery, that we were asked to take rest. See, no patient takes rest unless the method of taking rest is given to him. Now this pelvic traction, as I said, this I have learned from Bombay Hospital, from my Nagpur Medical College also, and when I went to USA, the chiropractors over there practice spinal decompression. They put computerized machine and they decompress the spine, and the patients are relieved. This is my own experience where my children are in USA. Many of them suffer from back pain. I advise them pelvic traction kit over there in the house only. Put them in traction and they are relieved. So, the essence of my treatment, as Dr. Bijlani asked Dr. Dragnivesh, how to get relief of the pain. Friends, I have been attending PG clinics and whispering about distal sodium channel block. Students don't know that. Or I think Dr. Dragnivesh knows it or not, Dr. Bijlani knows it or not, I do not know. But 1 cc xylocaine, 1 cc decometrol, 4 injections, inject them on the anterior, inferior part of the medial and lateral malleolus of the limb where he is getting pain. You can inject in both the limbs also, and immediately the patient gets relief. This mechanism, Ortho Global Group, all the members are following. Dr. L. Prakash has done tremendous work on this. And my own experience is that one additional district judge, he had come to me for severe pain, and I gave him distal sodium channel block, and he was relieved. Now, what is my protocol? My protocol is that put the patient on pelvic traction. Second day, third day, his SLR improves. I have got videos on my channel, Sri Krishna Drdhone. You can go through that. Then I put the patient 1 hour, 2 hour repeatedly for traction for 1 or 2 days, and then I start exercise. I start straight leg raising exercises, one leg 30 times, second leg 30 times, both legs 10, 10, 30 times, flexion on the abdomen, lifting up of the back, abdominal crunches. On the abdomen, legs are straight against the thigh. Then both hands are kept and shoulders are elevated. Slowly, slowly, with these exercises, the spasm and the pain gets relieved. Then I ask the patient to sit down in the cross-legged position. I ask the patient to do abdominal exercises in, out, in, out, in, out, 200 to 300 times. Then I ask the patient to hold the abdomen, bend forward, bend backward. Then put one leg ahead, another leg on the side, bend forward, bend backward. So these, and then ultimately I ask the patient to sit in Vajrasan. When the patient sits in Vajrasan, initially he gets pain, but as he daily does it, in a span of 4 to 5 days, all the muscles are relaxed. His SLR is totally free, almost free. And then we take this patient for epidural block. Now, 1980, I learned epidural block through sacral hiatus, 2 cc's of depometrol, 1 cc's halocaine, and 10 cc's of distilled water. This much bolus I used to inject from sacral hiatus to in the spine in the epidural space. But later on, while working in civil hospital, we started giving epidural block by number 22 spinal needle at L1, L2 level in the sitting position, so that when we inject that bolus, that means about 2 ampoules of depometrol, 1 cc xylocaine, 10 cc distilled water, this much we inject, the whatever remaining spasm which is there of the SLR, it is totally relieved. Now after the patient is relieved, my questions start, my answers start, my convincing the patient that this pain, the exercises which I have told you, these exercises without fail, you must continue these exercises daily. You must control your body weight. Whatever I have written on my case paper, your body weight, this is your Lakshman Resha. You must never cross this. No sooner you cross this, you will land up in trouble. So, after that, while I was in civil hospital, I operated many patients. But then after 5-6 months or after 1 year, some patients came back that my pain is still there. I am still getting pain. Not only that, the patients operated by other surgeons, they exhausted money, then they come to civil hospital. And again we put them into traction, correct their body weight, put them into exercises, and they get all right. So friends, non-operative management of back pain is a standard treatment advised by our expert orthopedic surgeons, which we are missing. So my request is that, earnest request to the Bombay Orthopedic Society is that, let me hold one workshop on non-operative management of back pain. The Dr. Dragnivesh, the surgery, minimal discectomy, microdiscectomy, all these things, I have got all the patients, all these microdiscectomy patients, laminectomy done patients, my operated patients, they come to me. I have got 35 years of follow-up of my own patient who comes after 5 years, 10 years, 10 years and 10 years. Now it's about 35 years that I am treating him conservatively. So I am going to circulate this brochure of magical results of outcome of the epidural steroid in prolapsed intervertebral disc. Second thing I want to mention that the back exercises which you suggest that the physiotherapists must teach them. It is your own duty to see what exercises the patient is performing. Further than that, now I have been awarded the Sports Excellence Award by Bombay Orthopedic Society, because when that award was invited, applications were invited. How many of orthopedic surgeons opted for that? About 6 orthopedic surgeons. Dr. Karthik, Dr. Patiwala, Dr. Prabhu, and one more person, and myself. I am 74 now. Dr. Dragnivesh and Dr. Bijani said that you should not do gym, you should not do games and all that. Friends, I am doing 10,000 steps daily, 45 to 1 hour badminton, 10,000 steps daily, and 2 hours of yoga. So, my earnest request is that yes, for earning money, for commercial purposes, you may, people opt for MRI, for crave for surgery. This is, I no, I don't have any say on that. But my eagerness is that students which are there, they must know epidural steroid, they must know distal sodium channel block, they must know Sarvangasana, they must know Vajrasan, they must know Dhanurasan. All these yogasans, all the orthopedic surgeons, young surgeons, they must know it. And keep yourself fit. So this message I give to my patients also. See, I'm not much technocrat to record all these things, but I have recorded videos of my patients on my YouTube, Sri Krishna Drdhone. I have written reviews of my patients, and patients come from quite far, from Gadchiroli, Nagpur. They come to me from Madhya Pradesh. Patients call me, and I have been invited by Sahyadri channel Doordarshan 3 times to share my experiences. That because you are a surgeon, you are saying don't operate spine. So this is because of my failed experiences. Now one more thing Dr. Dragnivesh has mentioned is the fusion of the spine. Let me tell you, unless your paraspinal muscles, abdominal muscles, your body weight is controlled, your muscles are strengthened, the fusion doesn't work. And posterior interbody fusion is not a routine thing to be done. As far as possible, reduce body weight of the patient, put him on exercises, and try to conserve as much as possible, which I have done it in several cases. Second thing which I advise my patients is to keep a pillow below the knee while sleeping on the back so that the hips are flexed and the spine becomes relaxed. Same round pillow, I ask the patient to put it on the lateral side and put leg on that and keep the pillow embedded to the abdomen. So friends, non-operative management of spine, back pain must be known to everybody. MRI, whatever is showing is yes, okay. But the extent of the MRI is being done is like that the patient, like a parrot, he reads the MRI report, he says, I have got L3, L4, L5 disc protrusion, and doctor has asked me for surgery and I don't want to get operated. So like that I have treated so many patients. Now to the extent that my rural people, they should be benefited. I have started charity clinic at my residence where I have put on 2 beds there, 2 attendants, only to give traction to the cervical spine, to the lumbar spine, put them on cycle for knee pain, exercises for the knee. Exercises for the knee, I tell the patients to flex, extend, 300 times morning, 300 times evening. Stand up, sit down 100 times in the morning, 100 times in the evening. And if they can climb stairs, on one stair only, they can climb, get down, and do knee exercises. I give intra-articular steroids and patients are very happy. So, my earnest request, for the knowledge purposes, you must know non-operative management of back pain. You must know yoga. Every child, every person, every orthopedic surgeon must sit in Vajrasana and see if he gets pain. If he can do it. If he can't do it, try it and it must be done. So I have raised this point for the AGM and I will circulate my brochure to the people only to know the non-operative management of back pain. I have seen operated patients suffering after 3 years, 4 years because they have not been taught to control body weight to continue yogasana. Friends, on yoga day, the whole world does yoga. Our Prime Minister takes part in yoga. At the age of 75 also, he is fit and fine. And Dr. Dayanand Dongaonkar has written yoga application for low back pain. So our history is beautiful. Our great surgeons have given tremendous knowledge to us. This knowledge should be spread to next generation. Thank you very much. Thank you.